My name is Dr. Thomas Krogan. I have 2 practices in northern Colorado. I was introduced to T Scan about 3 years ago. The product is a sensor that you place in the patient's mouth and have them bite on it. Instantly you see on the screen where their pressure points are, what tooth hits first. It's a real-time showing of what's going on with their bite. It's customizable. You can change the shape and size of the teeth in the computer program so you're really accurate on where their contacts are. It's easy to use, it's efficient, it's inexpensive. You can do it on every person. You can do it on people where you have a concern. I do it on some patients just to be sure everything is right. We're able to address problems quicker and easier than we used to. And it helps me educate my patients on how we can change things to make their occlusion better. The system's customizable. You can look more for the things you're interested in or if you're patient specific. But for me, educating the patient, letting them see that if we were to change your occlusion, if we were to change how the crowns were placed on these teeth, we could improve how everything works in the occlusal function. My initial investment in T Scan was an easy decision just based on the education I can provide. We now have patients that are excited about restoring their occlusion, bringing their occlusion back to something that's much more ideal than before, when it was so much harder to get them to understand that this isn't a good way to keep your teeth healthy, keep your mouth healthy, and keep your whole system healthy. Your patients see what's going on. You see what's going on in real time. And it makes it so much easier to address a problem where before I might have been chasing it with shim stock and paper and trying to find CR and then coming back and they're back again and they're getting frustrated, and all of a sudden now we see it on the screen. It's right there. If you're a clinician who's interested in seeing how T Scan can help you with the occlusion in your practice and educate your patients, visit them online.